So this is sort of Hologic's brag wall.
Yes, our wall of innovation, we call it.
Yeah.
So,
It sounds to me that you believe Hologic is a disruptive company, and you are proud of that.
as Hologic gets bigger, we affect more women around the world. I genuinely believe we're sort of this combination of just doing great stuff in the world, and we do make money, and that's okay. When the bigger we get, the better we are for women's health. We're impacting everybody, all women's lives, and then by definition, every man has a woman in their life, so it connects us in so many ways.
How did the ethos of Hologic inform your response to the pandemic?
There was no playbook for how to lead a company through this, and I would put us in several different stages. First off, we watched our surgical business. I'll never forget, in the month of April of 2020, that business dropped 90%. And at that point in time, we had no idea how long any of this was going to last. So we made a lot of tough decisions. We cut down on our manufacturing facilities. We instituted effectively kind of a 10% pay cut for all employees, but our leadership team took a 25% pay cut. We also suddenly realized testing is the most important issue. And our scientists here in this building were quickly working on creating some tests. And I'm so proud of what we did, but we also had to then shift all of our resources from existing products, and our teams just mobilized to approve within 24 hours of the first tests, of the molecular tests, to come to the US and ultimately shipped around the world.
So you were downsizing and also managing a startup at the same time in a weird way.
I tell the story about when the CEOs of Quest and LabCorp, the two biggest lab people, they were at the White House in May of 2020 on a Friday afternoon, and they were getting beaten up about the long turnaround. Well, our Panthers are high volume. We can run hundreds of tests in 3 hours, and the footprint of a Panther is not much bigger than this. And so as soon as we got approved, we were able to come to the rescue. It's not a lie to say that on Saturday, we got calls and major orders from both of those labs to install Panthers. And our teams raced out, and we produced more, our partners helped produce more, we installed them. And we single-handedly played a massive role in getting PCR molecular tests down to a 24 to 48 hour turnaround. That was us. And we take great pride in that. Our team's showing up when, by the way, much of the world was sitting at home and saying we should be locked down. And I was so proud of our team showing up here every day. They say tough times test character. I think there's the flip side is tough times reveal character. And I actually think that time revealed Hologic's character more than ever. That's the magic in the diagnostic world, right? When you can start to pinpoint exactly what it is, then we can pinpoint the actual diagnosis. So instead of trying to treat somebody with a broad spectrum antibiotic or whatever else, there may be other ways to treat them.
And cause less collateral damage as a result.
Completely, less side effects and everything else.
Can you talk about the mission of this company, helping women at every stage of their lives?
We start with our purpose, which is to enable healthier lives everywhere, every day. Starting really in the teen years with our, all of our sexually transmitted infection testing and everything else that is so critical to ultimately women being healthy when they get into the reproductive stage and everything else. And then we go into the lifelong testing of both Pap testing, HPV testing, and then of course mammograms and the innovations we've had in mammograms through to bone density, certainly more critical as women age. And then we also have our surgical division, which treats abnormal uterine bleeding, fibroids.
Why are 3D mammograms such a game changer?
If you think about a 2D image is effectively like looking through the breast and you get one image. And so the image can all be clustered. The 3D effectively gives you a bunch of slices. So we have, or pages in a book. So now instead of looking at the cover of the book, you're able to open up and see, oh, wait a minute, on page 38, there's a lesion that I can see more clearly. And so as soon as the radiologist has that ability to open up the book and look at all these different pages, suddenly you can see the tissue and break out the masses from the tissue so much clearer, which, part of the magic of our 3D mammography is it's both increased the detection of early stage cancers, anywhere from 20 to 62% in various studies. But more importantly, it's also reduced false positives by 42%.
I think some women might hear that and think, oh, I wonder if my doctor has that machine, or gosh, that sounds expensive.
In the grand scheme, when you amortize the cost of the machines over time, they end up, frankly, not even being more costly. And they're saving the healthcare system money because we've reduced all of these false callbacks. We're also reducing all these follow-up. So, in fact, we've ended up getting most of the insurers and systems around the world to endorse it because they actually see it's a cost savings to the total system. Now, what's still fascinating, though, and this is why, and it's the purpose of Hologic, and we've had to be the ones to fight for that. The systems around the world, the governments don't automatically adopt these. And in fact, if you even look in the United States, there's this thing called the United States Preventive Services Task Force. So we're now a decade into 3D mammography. Tons of data, tons of published studies, tens of millions of women have been helped. They still, in the United States, are considering 3D investigational. You've got a bunch of men making decisions, and it just always feels to me like when these are women's health issues, they just don't move at the same pace as, we get Viagra approved.
Let's talk about the Global Women's Health Index that you all initiated and really oversaw. What was the point of the Global Women's Health Index?
The Global Women's Health Index, I think, has the potential to have more of an impact on the world than any product we actually ever developed. And yet it's not a product and we don't sell it. We came up with the idea about being able to start to do a survey on an annual or biannual basis around the world on women's health. And so we developed, in partnership with Gallup, we've funded it, but they've developed the questioning to 120,000 interviews that we'll do every year in 116 countries in 140 languages. So really trying to get out there to understand the state of women's health. And we believe that now it's the first ever index where there are numbers. And as countries can now see where they rank and particularly which areas there may be opportunities, that we believe that can have a dramatic effect over time. We are now starting to get major discussions with a lot of policy leaders, health ministers around the world, curious about the data. The fact that we were doing this just got us invited in to become full partners at the World Economic Forum. World leaders want to hear what we're finding out in this. And I think that's going to be the magic to elevate the focus on women's health and elevate the policies and changes that I hope over the next 10 or 20 years will have a massive impact on women's health. When you're in this business, you're motivated to want to find it for somebody in your own family. That's how I always think about it. This is very personal. My own mother with breast cancer, my wife, my two daughters, I want to make sure that we have detection for everybody.
You all have had a phenomenal couple of years in a very difficult time, but moving forward, when you look towards 2022, 2023, it's hard to believe that we're there, and beyond, what are your hopes and dreams for the company?
I felt like Hologic was in the right place at the right time to make a profound impact on the world and women's health. And that was October of 2019, 3 months before the pandemic hit. What's fascinating about how we've responded over the last couple of years is I think we're even in a stronger position to make that impact in the world. Because of our COVID response, we're so much better known at all the highest levels of governments around the world. And we're able, therefore, to be talking about women's health in ways that they never really engaged before. And that magic, I think, is on the precipice that I think we can make a bigger difference in the world. We're going to affect more lives. It's magical to work for a company that you know is making such a difference.